Okay, so for anyone new to Cinzy, and again, we are an AMN healthcare solution. We're really a virtual care company, and that can mean a lot of different things to a lot of different people. And we're not really just going to focus on video today. The goal today is really to show you how to manage patients with chronic conditions. And today, focus on patients with cardiovascular conditions for Heart Health Month, and really how to use all the different modalities of communication within our platform and how they work together. And that's really our most successful clients, is how they're using the platform. So not just using it just for the telehealth, or just for the secure messaging, or just for the text and email or the assessments, but really how all these different modalities of communication work together. But our platform in general allows staff members, patients, family, and even community physicians outside of your organization all to communicate in one platform. And that's really, at the end of the day, to improve the patient experience. Our platform is device agnostic, and this is for staff and for patients and for family members. So everyone can use a device they're comfortable with, whether it's their Apple device or Android or laptop or tablet. We operate off of any of those devices. And then even though we'll be focusing solely on managing patients with different heart conditions, I do want to point out briefly in the beginning our staff-to-staff messaging and communication options, because you could have a situation where you are a nurse or one of your clinicians is at a patient's home or at a facility with that patient, and they might need to engage another team member that's remote, whether that's over video or secure messaging. So that's just as important as being able to engage with patients and family members directly. So just really two more slides, and then we'll hop right into the platform itself. But we're really one of the best in the industry in managing patients with complex chronic conditions. So as I was mentioning, really an all-in-one comprehensive communications platform that consolidates many methods of technology into one place. And we do have a lot of clients that use different vendors, for one for secure messaging possibly, and one for video. And we really do a good job of putting that all into one platform. So it makes it very easy to use for your staff as well. So today we'll cover some of these features that you see on the screen right now, whether that is the video visit or the secure messaging, and of course, remote patient monitoring, which is a big one in the marketplace today. So traditionally, we did start as a communications platform, pulling together video, text, email, secure messaging, and assessments all in one platform. But we have added remote patient monitoring in the past couple of years, and that really allows patients to connect a Bluetooth-enabled device, and they can take readings remotely, whether that's for blood pressure or oxygen levels or heart rate, and you can view those readings in real time. So we are device agnostic as well there. A patient could go to CVS or Walgreens and pick up a Bluetooth blood pressure cuff, and you can monitor that patient in between visits. So we'll take a look at that briefly today. So I'm sure, as you all know, CHF, or congestive heart failure, is the #1 cause for rehospitalization across the country. And we see this with many agencies that we work with. I believe the latest stat is, I think it's around 20 or 25% of patients that are discharged are rehospitalized because of this condition. And so most of it happens within the first 7 days or 14 days or 30 days. So it's really, what are you doing up front when a patient does come home to engage that patient and stay on top of them, of what's happening to them. So let me go ahead. I'm going to switch over from PowerPoint, and we'll switch right into Cinzy here. So everyone should be seeing my screen right here with the Cinzy platform. And again, we're device agnostic. So you're seeing me on my laptop right here, but I could be out in the field at a patient's home on my mobile phone or my tablet, and the experience is going to be exactly the same for that clinician. So I'm going to start off just as the clinician view and being a staff member, and just showing you the different aspects of the platform on how to manage a patient with a chronic condition. But we really designed the platform when someone first logs in to the main screen. they'll have the most important pertinent information for them for their day to get started. So as you can see here, my patient here, James Cook, he is a part of a program, the CHF program, and we'll talk about what those do here in a minute. But a part of that program, maybe within the first 7 days, you do have a scheduled virtual visit with that patient. So again, very, very severe chronic condition, staying on top of that, you might want to have a video visit to review maybe their prescriptions, maybe any new symptoms they might be experiencing. So just the ability to schedule that visit, you do have that, but we do provide a lot of that functionality on demand. So just me as the clinician, if I do have any notifications or any recently viewed profiles, I can view those directly on my main screen. But we really break down the platform by patients and by staff members. So just to show you the staff side real briefly before we hop into the patient area, I can view all my staff members here within the member directory, but we'll also configure the platform based specifically on your workflows. And we work with a lot of organizations that are multi-location, multi-state, or even just some of our customers that might just have one location. But we can really build out the platform based upon how your users are broken down, maybe by their roles, or maybe if you do have some users that are at a specific facility. So as I can see here, I have my specific clinicians that are based in Bayshore Assisted Living Facility. And we do have some pretty advanced call functionality built in. So, if I'm out in the field and maybe I'm sitting with a patient, maybe I have some questions on their recent blood pressure medications, and I need to reach someone in this facility, I don't care if it's any one of these three folks, I could select first available right here, and it's going to route to the first available person on video. Okay, so just really quick time savers for your staff to be able to reach someone on demand very quickly. So again, going back to my example, managing a patient with CHF, imagine I'm sitting there at the patient's home, and maybe it's a non-urgent issue, and I need to get in touch with Steve, who might be the patient's nurse. Maybe he's out and I'm covering for him, or maybe he needed to go see another patient. As you all know, staff shortage, nursing shortage is a huge deal, right? So one of our use cases is being able to use this platform to battle some of those the staffing shortage issues. So maybe Steve is an hour away and needs to go see a couple other patients, but I really have two options here. I can bring in Steve over video, and we can have up to 6 people on a video visit if I need to, and he can see me sitting here with the patient. Or maybe it's just a non-urgent, and we can get dropped right into our secure messaging. So platform's HIPAA compliant, 256-bit encrypted for those technology folks. So think of your highest levels of encryption, and that's all the patient data, that's all your conversations, that's all the video visits, everything is completely encrypted on the platform. So as you can see here, my conversation with Steve from 2 months ago, you have the ability to share pictures. Maybe I need to snap a picture of swelling on the patient's hand, and I need to send it over to Steve, right? I can download that picture if I need to upload it in the patient's chart in my electronic medical record for later. I could also do that. You could share documents as well on here, and we also have full group messaging, okay? So again, we get a lot of clients that might be just using a secure messaging vendor, but it's great to have it all in one platform, especially when you're wanting to optimize patient care, having everything in one local area. So let's focus on the patient side right now, and this is really managing a patient with CHF possibly. So we're one of the best in the industry for patients on ease of use and for family members as well. So we provide an app-less experience for patients. We do have an app available for patients and family members in both app stores, in Google Play and the Apple App Store. But if you have a patient or a family member, maybe they're not as tech savvy, or maybe they've never been in their app store before and downloaded an app, they can use this platform and you can engage with them directly. So let's just say Jason Compton here, maybe he's one of my CHF patients, and I'm the clinician again, and I'm looking at the patient chart right here. I have a couple different communication options on top here, and think of these as my on-demand communication options. So I have regular text and email. If I just need to send Jason a non-PHI type of message, I can text and email him directly at the platform. Never going to share my personal cell phone number with that patient. And then I have secure message for this chat bubble. And then I also have the video visit option. So let's just say Jason here again, one of my CHF patients, maybe I want to do a video visit with him. Maybe I want to find out his recent oxygen level readings or his heart rate or a blood pressure reading. I can just chat directly with Jason as I normally would. And what's going to happen on the other side, and just to share with you all real quickly, just from the patient experience, Jason is going to receive a text message or an email that looks like this. And you can completely customize what you want the message to say. This is just here, for example, all the patient needs to do, they don't need to go ahead and log in or create a username and password and go through all that might prevent a patient from logging into a platform. All they need to do is click on that. That link is a unique URL for them, so it knows exactly who they are. It's a secure link. They click on that, and then the message is going to launch into whatever web browser is on whichever device they're using. So if they're on a tablet, if they're on a mobile phone, it'll launch in directly. So right now we're in a secure chat, and patients have the same exact functionality. They can, snap a picture. Maybe they want to send you a picture of their blood pressure reading or their oxygen level reading, and you can engage with them very quickly. So this is a secure, HIPAA compliant chat. This is a major way a lot of our clients engage with their patients. So again, if you're new to the virtual care arena, all your patients, just as they do in the everyday world, might not want to communicate the same way. So they're not all going to communicate the same way. So some might prefer video, some might prefer text and email or secure chat like this. But again, we give you the option to know what your patient and use what your patient prefers. So from the patient experience, as you saw, I didn't need to log in. I didn't need to do anything because this link is specifically for me. Okay, and just back on the home screen, patients, if they do have any reminders, and we'll talk about remote monitoring here in a minute, it'll be customized to them directly. So we'll have your logo and branding up here where it says Cindy. And again, thinking back to those CHF patients, just a very high acuity, high risk type of patients. On the Cindy platform, we give you the ability, you can assign a care team to that patient. So let me just take a second and explain this. So a care team is your internal staff members, and you can either assign a group like you see here, and these are completely customizable, configurable groups where you can add 5 or 10 staff users in here. There's really no limit on the amount. Or if the patient has a specific clinician that you want to assign to them, you can do that as well. Great thing about the platform, instead of the patient, maybe they have a question on their prescription, or maybe they're running into, an issue of a symptom that they're worried about. Maybe they're short of breath. They don't need to pick up a phone, call 1-800 number. They can simply click on that first available. And what it's going to do, it's going to route to the first available person within that group specifically and be connected over video. So think about it, just a very quick way for your patients to reach a staff member, whether it's by secure messaging or whether it's by video, they have that option. So let me go ahead and hop back over here to the patient side. Okay, so just a little bit more about the patient profile itself directly. Really set it up here for ease of use for the clinician. Okay, so we did talk a little bit about the care team specifically, but one of our big differentiators is many of these patients you might not be communicating with directly. Okay, so we have the ability to add family members as well. We also have the ability to communicate with them directly. So maybe that patient, James Cook, maybe he's a CHF patient, and he doesn't have the ability to communicate with, maybe he doesn't have a smart device, or maybe he's not tech savvy enough, but the family member that lives next door or that lives with the patient can be added directly within the platform. Okay, so Meredith Cook, as you see here, is the patient's family member. And I have my same options up here. I can text an email, I could secure a message, or I could do a video visit. So really important, maybe you have an elderly patient. Again, maybe they're a CHF patient. You're not able to engage with them directly. You can easily add a family member in here. All you need is their mobile phone number or an email address. That's all it takes to register that patient, that family member within here. So that was really the on-demand communication options, okay? If we want to do some of the automated communication options, and this was really where it comes into play of managing patients with chronic conditions, we have something called remote patient monitoring and programs and assessments. So let's dive into each one of these directly. So as I mentioned, RPM or remote patient monitoring is really the patient's ability to connect a Bluetooth device, whether that's a blood pressure cuff or a pulse ox or a scale or a thermometer or a glucometer as well. And we can also measure heart rate with that pulse ox as well. And these are everyday devices, like I mentioned, that someone can order off of Amazon or Walmart or Target, any retailer that you can think of. And we went device agnostic here just to make it easy for agencies and for patients as well. And we really found pre-pandemic and during the pandemic as well that patients really loved this because they were getting a brand new device. They knew it wasn't reused by another patient. They now own the device and can continue their journey of monitoring their condition even after care had concluded. So patient, maybe CHF patient, I want them to monitor their oxygen levels up to 3 times a day. I can enroll them in an automated text and email, and they'll receive that maybe 8 a.m. starting with. They click on the text and email, they go right into the application, they connect the device onto their finger, and then that reading is automatically transmitted here to the clinician. So me as the clinician, I can come back into my days, weeks, or month, but I can also hover over the specific date and view the value of their last reading and start to see some trending here. And we'll even give you the range down here. But if you want to view the full data set, maybe you're working with a physician in the outside, you want to download that data, you can absolutely do that out of the platform. Okay, so one way to get data, maybe you want to create some alerts as well too. So we have the ability to tag a patient with an alert. So maybe a patient's oxygen level is dropping to 92 or 90% or 89%. You can create an alert where if someone crosses a minimum threshold that you have set or a maximum threshold, it'll generate a secure message to your team as well. So really, the last 2 portions are programs and assessments. Okay, so from the patient perspective, this is going to be the automated communications they receive. All right, so these are completely customizable. And if you're new to the patient engagement world, we do have a content library in Synzi. So if you do need a starting place, whether it's condition specific, like as you can see here, patients enrolled in a CHF program, or maybe it's administrative outside of managing a patient with a chronic condition. Maybe it's a welcome program. So just welcoming them to your agency and here's what they can expect. We have a variety of programs. But for this specific topic today, patients enrolled in a CHF program, and over the course of 30 days or 60 days, they might receive some text and email reminders. Maybe on day 1, again, welcoming them and here's what they can expect. Maybe on day 2, it's reminder to take their medications or reduce their sodium intake. And you can include website links, you can include video links as well. We have many clients that get pretty creative with these. So just a quick client story. We do have a lot of customers that start with this portion of the program because they're looking to manage their patients with different chronic conditions. So client down here that I can think of off the top of my head down here in Florida, they were looking to really target their top 5 conditions that were problematic for readmissions. So you can think of your typical high flyers like CHF, COPD, diabetes, just to name a few. And they created 60-day programs. They enrolled the patients in those specific programs, and over 60 days, they received those automated text and emails. And then they had a QA team follow up with those patients after the 60 days were concluded. They found patients were actually reading these messages and they could remember specific messages. A lot of times it just put their mind at ease because they might get a text that just said, if you're experiencing any of these symptoms, swelling, shortness of breath, dizziness, whatever it might be, here's the phone number to call. Here's how you can reach out to your nurse directly. It was really that extra touch point, especially in between visits, that made the patient rethink, okay, I can reach out to my nurse. I don't necessarily need to call 911 if I do run into an issue. So patient program management is really at the forefront in our platform of managing patients with chronic conditions. A lot of new clients come on board, or even prospective clients that look at our platform and expect just to see just our video or maybe just the secure messaging. But this is really the pinnacle of managing patients with those different chronic conditions, being able to send out those educational messages. And then if you do get a question, or if you do get a response from a patient that does need help, how are you following up with them? It's not just traditional phone calls. It might be text and emails. It might be that secure messaging or video visit. So on the other hand, maybe you want to gather some information. And this is really important because, it's great pushing out information, and it's great. Maybe I want to send out a secure message or do a video visit with a patient. But maybe in between those visits, maybe you're not seeing a patient for a week or 2 weeks. And I want to stay on top of them and see if there's anything new going on with them. I have the ability to schedule an assessment for them. And it could be an automated assessment as well, okay? But I can also manually add an assessment here to the patient. They'll receive that assessment by text or email, so they don't need to go logging into an app to complete these. And then over here, what you see is all the completed assessments that the patient has done. And I just assigned this new one right here. So let me just go ahead and click into one so you can see what this looks like. And again, just very similar to programs, these are all completely configurable. We do have a content library with assessments as well, but if you do want to build your own, you have that option also. And I'm going to show you here in a minute from the patient perspective of what it looks like to take these assessments. So as you can see here, I did have some yes/no questions and some multiple choice and some fill in the blanks. Some of the questions, and you're going to see this in real time here for the patient, is, have you weighed yourself today? Do you need any help with your scale? Are you experiencing any new symptoms? We have some great functionality on the assessments where we're not just gathering this data, but we have real-time alerts. So let me give you an example. Let's just say you have a CHF assessment going out to all your CHF patients on a daily basis. They'll receive this survey every morning at 8 a.m. Patient here, James Cook, actually was asked the first question, have you weighed yourself today? Yes or no question. He responded no. So I have a flag. I have an alert set up for that specific question. Anytime someone responds no, I want my team, I want that specific clinician to be notified of that immediately. So someone doesn't need to be monitoring a dashboard, waiting in for an abnormal response to come in. Patient responds no, team members will receive a response automatically. And as you can see here, back in my chats, back in my secure messages here, if you saw down here, me as a clinician, I had gotten this in earlier back in September. This was actually for a COVID questionnaire. As you can see here, the patient said, they don't wear a mask in public. So I had gotten a secure message response alerting me of the patient's response. And so from here, I can take action immediately as that patient's nurse. I can type James a message. I can send them a document. I can do whatever directly from here. So again, we capture all the information in the background, but if you do need to alert your team immediately of that, you do have the ability. So we won't get into too much of this today, and I'm going to show you here in a minute the patient experience, but this is really the administrator experience. And we have something called Enterprise Admin. And this is really, think of this as your back-end command center. So from here, I can manage reports, I can manage clinical content, all those different automated programs and assessments. But I just wanted to show you real quickly a report, okay? And so this is really helpful when you're really looking to target specific chronic conditions. So I can pull up all my patients that have ever completed a CHF follow-up assessment. I could see the response rate very quickly. I could see how many were complete or incomplete. And now across my entire patient population, I could see, how they are responding, right? So just very quickly, I see I don't have a very compliant patient population. 95% have responded no. So I can take action from here. I can look up specific patients if I need to. Maybe I want to drill down into patient James Cook here, and I have years and years of data on patient James Cook, so it might take a little bit longer to load. But I can, verify directly here all the assessments that he's taken, right? And I can see the exact questionnaires, the exact responses. I could see the flagged responses as well too. So any of the interventions that have been generated, okay? So I can message the patient directly from the report as well, and all our reports are downloadable by CSV. And if you wanted to come here into the specific intervention section, this is going to be the area where all your patients responded to and picked a response that had been flagged. So as you can see here, I use James Cook very frequently. This would be across your entire patient population. So it's a great dashboard, a great checklist to go through all your patients. Maybe you're targeting all your CHF patients and you want to view all their responses directly. So let me go ahead. I am going to just share my iPhone one last time again. And just show you what it looks like again from the patient perspective. Again, this is a different patient than I was using earlier. This is James Cook. This is my iPhone. Again, they'll have all your branding up here on the top where it says Cinzy. Right on their main screen, if they do have any scheduled virtual visits for later today, as you can see, that's right on the main screen. I am using this patient for remote patient monitoring. So if they do have any readings that they do need to take, whether it's weight or oxygen levels, those will be right on the main screen here. And as you can see, if I have a Bluetooth scale, I could hit take a reading, step on the scale, and take a reading directly. Just to show you how easy it is for a patient connecting devices, here's the list of available devices they can connect. So any Bluetooth devices here directly. I'm just going to remove that. Just to show you what it looks like, we do have an integration directly with Apple Health and Google Fit for those folks on Android devices. So if you do want to pull in any data that way, you can. But if I did have my scale here, I do have a pulse ox here, but just for time's sake, I won't connect it and take a reading. They can connect it directly. And once it's connected and paired, they never have to worry about it again. And they can get those reminders come in automatically, take a reading, be sent directly over to the team. So as you can see here, here's my assessment. And this could be completed over text and email, like I mentioned. But imagine I'm a patient with congestive heart failure. I'm going to be getting this assessment on a daily basis if I want, or maybe just once a week. You can explain to the patient what this assessment's for, how long it's going to take, when you need them to complete it by. If they go here to start assessment, here's that questionnaire that you just saw earlier, okay? So again, you can do yes, no questions. You can do multiple choice, fill in the blank, really whatever you want to set up here. So I'm going to say no, I haven't weighed myself today. I'm going to say I do need some help with my scale. And I could do a single choice here. So this is not multiple choice. We're just picking one choice here. But I'll just say it's on someone to contact me between 12 to 3. And me as the patient, it's done. And the assessment's complete. And just to show you the alerts in real time, I wasn't sharing my desktop screen, but if you saw a little notification would have popped up here. Now I do have a new chat bubble. And as you can see, it came in real time. patient said, no, they haven't weighed themselves today. I'm Dean Klein, James Cook's clinician here, so I got alerted in real time of this. So really just to recap before I check to see if there's any questions, really the platform more than, there's more to virtual care than just telehealth. And really our most successful clients are using all the modalities of automated text and emails, assessments, RPM, virtual visits, secure messaging. They're using more than just one facet of that to really manage their patients with chronic conditions. So goal of the platform, really to stay engaged with your patients in between visits, especially also to manage those patients, right? So being able to see all the different cohorts of patients directly and being able to manage them and to send out automated communications directly to them. So let me just see, and I see Nikki is typing, and just see if there's any questions. And Nikki, if you want to pop on and let me know if there's any questions. But I believe more of the questions have been focused around recording, and that's great. And if there's no questions, I appreciate everyone's time today.